What if two supplements sitting right next to each other in your kitchen cabinet could quietly increase your risk of dangerous bleeding? Millions of Americans take supplements every day, believing they're completely safe. They swallow pills with their morning coffee, never thinking twice about what happens inside their bodies when these supplements mix. But here's what cardiologists want you to know. Some supplement combinations can interfere with blood clotting, interact dangerously with prescription medications, and even increase the risk of internal bleeding. Today, you're going to learn about 3 supplement combinations that cardiologists often warn patients about. And stay until the end, because the third combination surprises almost everyone. Before we dive in, make sure to hit that like button and subscribe, because your health matters, and we're here to help you make informed decisions. And drop a comment below, which supplement do you take every day? Let's get started. Number 1. Fish oil plus vitamin E. Why people take them together. Walk into any health food store, and you'll see fish oil and vitamin E sitting side by side on the shelves. Many people buy them together, thinking they're getting a powerhouse combination for their heart. Fish oil is one of the most popular supplements in America. Millions take it for heart health, brain function, and reducing inflammation. It's rich in omega-3 fatty acids, EPA and DHA, which have been linked to numerous health benefits. Vitamin E is another heavy hitter. It's known as an antioxidant that supports immune function, eye health, and heart health. Many people add it to their routine because they've heard it protects cells from damage. But here's where it gets tricky. Both of these supplements have something in common that most people don't realize. They can both affect how your blood clots. What happens inside your body? Think of blood clotting like a repair crew fixing a crack in a wall. When you get a cut, your body sends in a team to patch things up quickly so you don't lose too much blood. Fish oil at high doses can slow down that repair crew. It has mild blood-thinning effects. Research shows that omega-3 fatty acids can inhibit platelet aggregation, meaning your platelets don't clump together as easily to form a clot. Vitamin E in high doses can do the same thing. It can interfere with vitamin K, a nutrient essential for blood clotting, and also affect platelet function. Now, if you take both of these at high doses together, you're essentially slowing down the repair crew from 2 different angles. The risk of bleeding increases. The National Institutes of Health advises caution. Their Office of Dietary Supplements notes that omega-3 fatty acids may prolong bleeding time, especially in people taking anticoagulant medications. Similarly, high-dose vitamin E can interfere with clotting and may increase bleeding risk. According to experts, typical doses of fish oil, around 1 gram per day, are generally not associated with clinically significant bleeding. And the recommended daily amount of vitamin E is 15 milligrams per day, which most people can get through food. The risk really comes when you take high-dose supplements, especially without medical supervision. Safe alternatives. If you're concerned about this combination, consider eating fatty fish like salmon twice a week instead of taking fish oil capsules, getting vitamin E from a balanced diet. Number 2. Fish oil plus prescription blood thinners. Why this combination is common. Here's where we need to have a really honest conversation. Fish oil is often recommended for heart health, and blood thinners like warfarin, apixaban, Eliquis, and Xarelto are prescribed to people who've had heart attacks, strokes, or who have conditions like atrial fibrillation. So it makes sense that some people are taking both. But this is where the risk becomes much more significant. What happens inside your body? Let's understand what blood thinners do. These medications work by interfering with your body's clotting process. Warfarin, for example, blocks vitamin K, which your liver needs to produce clotting factors. Apixaban and rivaroxaban directly inhibit specific clotting proteins. The goal is to prevent dangerous clots from forming in your blood vessels, clots that could cause a stroke or heart attack. But here's the thing, blood thinners already reduce your clotting ability. When you add fish oil, you're adding another layer of blood-thinning effect. The National Center for Complementary and Integrative Health explicitly states that omega-3 supplements may interact with drugs that affect blood clotting. They recommend that people taking anticoagulants or NSAIDs discuss omega-3 use with their healthcare provider. The Memorial Sloan Kettering Cancer Center takes a stronger stance. Their guidance says, don't take omega-3 if you're taking blood thinners such as aspirin, heparin, warfarin, clopidogrel, apixaban, or rivaroxaban. One case report highlights the real-world risk. A 67-year-old woman had been taking warfarin for 1.5 years. Her INR, the measure of clotting time, had been stable at 2.8 for months. But after she doubled her fish oil dose from 1,000 to 2,000 milligrams per day, her INR shot up to 4.3. Another report described a high-dose omega-3 supplement associated with subdural hematoma, bleeding in the brain, requiring surgery in a patient taking 6 grams per day. Number 3. Garlic plus blood thinners. Why people take garlic. Here's the third combination that surprises almost everyone. Garlic is one of the oldest known health remedies. People take garlic supplements to support heart health, lower blood pressure, reduce cholesterol, and boost immune function. It's available in many forms. Garlic supplements in pills or capsules, aged garlic extract, raw garlic powder. It seems so innocent. It's just food, right? But here's the thing. Garlic is much more powerful than most people realize. What happens inside your body? Garlic contains compounds that affect platelet function. Specifically, garlic can inhibit platelet aggregation, meaning it stops platelets from clumping together to form clots. This is actually one of the reasons it's been studied for heart health. Less clotting could mean less risk of heart attack or stroke. But this is also where the risk lies. Combining garlic with blood thinners. When you take garlic supplements along with prescription blood thinners like warfarin or apixaban, you're essentially doubling up on blood-thinning effects. The effect of garlic on platelet aggregation may be irreversible. It lasts for a significant period of time. This means even after you stop taking garlic, your blood may remain thinner for a while. The Taiwan Food and Drug Administration specifically warns about this combination. Their guidance notes that for patients with cardiovascular disease taking antiplatelet or anticoagulant medications, adding garlic supplements can increase bleeding risk. The National Center for Complementary and Integrative Health summarizes the evidence on garlic, including potential bleeding concerns for people taking blood-thinning medicines or preparing for surgery. Safe alternatives. If you want the benefits of garlic without the risk, use fresh garlic in cooking. This is generally safe and provides health benefits. That's it for today's video. Which supplement combination surprised you the most? Was it the fish oil and vitamin E, the fish oil and blood thinners, or the garlic and blood thinners? Drop your answer in the comments below. I read every single one. And here's a question for you. Did we miss a supplement combination you're curious about? Let me know. We'll cover it in a future video. If you found this helpful, please hit that like button. It helps more people find this important information. Make sure you're subscribed to the channel and tap the notification bell so you don't miss our next video.